It does not smell pleasant in the Malvani neighborhood of Mumbai, India. But Deacon Sebastian Fernandez does not care about the smell. He wants to promote a new way of healthcare for the poor. Mahim is another poor part of Mumbai. Here, Deacon Jaime de Fonseca and his wife Ligia inquire about health, hygiene and medicine. However, without the guidance of a staff member of the local Catholic community centre, they would be lost. The answers are always the same. Fevers, colds and infection force people to spend most of their small incomes on expensive medicine. But that is changing. Jaime and Ligia meet regularly with the staff of the community centre at St. Michael's Church. Together with Sharon Rodriguez from the Health Promotion Trust, they plan the next series of workshops based on the assessments done by social workers and deacons like Jaime and Sebastian. The idea is as simple as it is effective. These herbs, spices and vegetables are used in almost every Indian kitchen. Most of them can be turned into preventive or healing medicine. How this works is taught in these workshops for women from poor neighbourhoods all over Mumbai. Here, women from Malvani discuss what they have learnt about a wide variety of natural home remedies. Like all the deacons in the Archdiocese of Mumbai, Jaime participates too, as does his wife. Deacon Sebastian is attending a workshop with Sister Sahaya. The topic is the same, but the language is Tamil, not Hindi, in order to serve the large Tamil community in this part of Mumbai. Sebastian has a very convincing answer to the question of why he cares about health as a deacon.
If the family is healthy, they will be able to pray, See, let's see, if there is a sickness in your family, people are falling sick, they have to run to the doctor, your whole mind is disturbed.
For Sister Sahaya, teaching the women is the most effective way.
Teaching one woman is equal to teaching the whole family. Because the women who takes care of children, their food, childbearing, taking care of the child, taking care of the husband, even taking care of the whole family. And it is the women who takes care of the diet of the family. Promoting a health of a woman is promoting a health of the family.
Afterwards, Sebastian visits women who have participated in the courses to follow up on the outcome. This woman had been suffering from diabetes for a long time. On the course, she learnt how to use okra for her condition. The cut pieces are soaked in water overnight. The next morning, she sips the water slowly. After a while, she was able to reduce her blood sugar with this remedy at a remarkable rate. Furthermore, she saves some 10% of her monthly income of around €100 due to fewer expenses on medicine. Many women who took part in the courses now grow their own plants in whatever space they have. The tulsi plant makes a perfect remedy for colds and coughs, especially for children. Jaime and Ligia are once again on their way in the Mahim neighbourhood. This woman had been suffering from severe heartburn for quite some time, but not anymore. Cumin and coriander boiled in water make an alleviating drink, which she learnt about on the Health Promotion Trust course. The next stop is a big apartment complex. This lady takes care of her elderly parents by herself. Jaime and Ligia want to find out how she is coping with this difficult situation and what kind of help is needed. These assessments are part of the program. Jaim and Ligia have been doing this kind of work for many years. They were able to give up their jobs and work full-time for the church. For Jaim to become ordained as a deacon was a natural extension of his work, as he put it. Unlike other deacons, he does not wear a clerical collar to work.
I've been clericalized and I don't want to be more clericalized. What I am doing is sufficient. So maybe I wear this cross to indicate I'm a deacon. I don't have to go around wearing a cassock. I would say the respect comes from the way you deal or treat people, and that's it. It's not necessary you wear a cassock to gain that respect. I have not had, I would say, all happy experiences in my interaction with the clergy. I've had some very nasty experiences too. But then my focus is always that I have not come into this vocation, into this work of mine because of my ordination to serve a priest, but I've come to serve the Lord.
Serving the Lord in this place means that they will look for the much-needed support for this woman. Ligia knows what she is going through, as she herself takes care of her own elderly mother at home. Jaim and Ligia share the work, but he is the deacon. At his ordination, a priest said, half-jokingly to Ligia, "Now he is one of ours."
I said, he received the sacrament of matrimony first, and then now his ordination. So the church is not going to dissolve his sacrament of matrimony to be ordained. So I don't worry about that. Yes, at times I did think also that it would be nice if I could be a deaconess and join him, in this work more closely. To be a sign also, a sacramental sign to the people. On the other hand, that not being possible for whatever historical reasons or whatever decisions of the church, it doesn't stop me from carrying on the mission of the church.
The last visit this afternoon brings them to an elderly couple. Peter and Marie have lived here half their life. The man has been suffering from open legs for 10 years. An elderly doctor was caring for him, but the doctor died recently. Now they are alone.
Feel very helpless actually. Feel very helpless. It's like you feel the pain of God. And at times there's no answers for their problems, their situations. You wonder how to handle it.
For me, this coming to these places is actually coming into the church. This is where the church is, according to me. And I believe that my sacramental duties at the church during my weekend ministry, it is one part of my life as an ordained person, but it is more so to coming into these homes and washing the feet of these people, literally, physically, doing that kind of work of touching them, being part of their lives and sharing their pain and bringing some hope, talking to them about some kind of a solution they could find for themselves, for a better life.
The next day, Jaim consults with the social worker at the community centre about what kind of medical help they can provide for the elderly man. In some cases, they can transfer poor patients in severe conditions to the hospital. And of course, there is no question about creed or race in order to make that decision. A few days later, Jaim and Ligia have organised a wheelchair to bring the elderly man to a health post near to the community centre. Sometimes the spices, herbs and vitamins are simply not enough. But of course, the deacons and social workers in the Archdiocese of Mumbai will continue to work with these wonderful natural remedies wherever they are effective.